Hello friends, welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the bright side of the health. In today's video, I'm going to talk to you about different stages of Bell's palsy. You must have heard a lot about Bell's palsy in this channel. Everybody thinks Bell's palsy is a condition which starts and gradually ends. But do you know that Bell's palsy are also in different stages or else different categories? According to the neuromuscular re-education technique, the patients who are suffering from Bell's palsy are classified basically on three categories. And basis of these three categories, the treatment plan is decided. So, in today's video, I'm going to talk to you about those three categories so that you can identify and understand on which category you belong to and what is a general treatment plan during each category. So, if you are curious to know about this, make sure to watch this video till the end. So, let's begin. So, as you all know, Bell's palsy is a condition in which your seventh cranial nerve or else your facial nerve is affected. After this, there is a paralysis of the face, which usually lasts somewhere between 3 months and to max up to more than 1 year. Depending on the level of nerve injury, to what extent this nerve damage lasts is dependent. But if a patient gets Bell's palsy, they are basically divided in three categories. The first category is an acute Bell's palsy or else say flaccid paralysis, which is the most earliest part or else the earliest phase of Bell's palsy, where your face is kind of completely paralyzed or else slight movement which gradually starts to come automatically. Along with medication and basic therapeutic techniques, patient can gain maximum recovery during this period of time. But this is the most crucial time for Bell's palsy recovery. Hence, the highest amount of caution needs to be taken at this point of time. First stage of Bell's palsy, according to neuromuscular re-education technique, is also called as the initiation phase, which means this is the time where the muscle gradually starts initiating the movement from complete paralysis to gradual movement. The second stage of Bell's palsy is paretic stage or else paresis stage. Even it is called as facilitation stage, which means definitely there is movement which has returned back, but these muscles are weak compared to the normal side. And that's why this is the time where a lot of facilitation or else help is needed for these muscles to kind of gradually increase in its strength. And that's why this stage of Bell's palsy, according to the neuromuscular re-education technique, is called as the facilitation stage of Bell's palsy. Here, the focus is on improving the muscle strength, improving the muscle control. And the third stage of Bell's palsy is the most chronic stage of Bell's palsy, where the patient has kind of crossed more than 6 months from Bell's palsy, and along with that they have developed synkinesis. That's why the third stage is also called as synkinetic stage. This is for patients who have got Bell's palsy which is more than 6 months old and they have synkinesis. They are considered under this category. And according to the neuromuscular re-education technique, this category is also called as movement control or else relaxation phase, as the focus is on reducing the synkinesis and allowing the muscles to relax to the maximum potential. So, as I mentioned, there are three different stages of Bell's palsy according to the neuromuscular re-education method. These stages are: first is the initiation phase, the second phase is the facilitation phase, and the third phase is movement control and relaxation phase. Now, in all three different categories, the treatment plan is also variable. So the first category of patient who are in the acute stage or is the flaccid stage of Bell's palsy, there the treatment plan comprises of the most important thing, facial massage. Facial massage helps in mobilizing the soft tissue, improve the blood circulation and also maintains the muscles flexibility. Apart from massage, this is the time where active assisted exercise should be used. Active assisted exercises are nothing but the exercises which is done with the help of hand. That's why if you are in an early stage of Bell's palsy and if you feel there are no movement that has recovered, please do not try to do your movement yourself, but take the help of hand in doing those exercises. I've already made a video on how to exercise in the early days of Bell's palsy. Make sure to watch it to understand and see the demonstration of the exercises. And the third most important part of treatment in the initial phase of Bell's palsy is patient education. Since there are a lot of misconception, misinformation which is present, as well as patients are in dilemma whether to do exercise or not, this is the time where you should talk to your physiotherapist and understand the treatment program, and this is the time where there is a bigger list of don'ts than do's. That's why there are many things which you have to avoid. For example, you should avoid exposing yourself to direct sunlight. You should also avoid exposing yourself to harsh lights. You should avoid exposing yourself to air condition or any kind of cold temperatures. You should definitely avoid doing mass movements, which is the biggest mistake and the most commonest mistake that patients make. And lastly, you should also avoid doing any kind of forceful or else resisted exercise. Resisted exercises are basically the exercises in which you give resistance to the movements, since this increases the chances of you getting synkinesis in future. Coming to the stimulation, there is a lot of confusion regarding stimulation as well. Ideally, stimulation is only needed in the flaccid muscle, which means the muscles which are not moving at all. You do not need to apply stimulation to the areas which have started functioning completely. So don't be tempted to continue your stimulation for a long period of time, as it is not going to help you out in any ways, but rather than that, it will kind of harm you in your recovery process. So this is the treatment plan in the initial phase of Bell's palsy. Once you have gone through this phase, then if you are lucky enough, your Bell's palsy will gradually resolve within 3 months itself, and you don't move further in the second stage of Bell's palsy, which is a very good news. But unfortunately, 30% of patients take more time than normal to recover from Bell's palsy. Now, if you are lucky enough, you will not get into the second or third phase of Bell's palsy. 90% of people who suffer from Bell's palsy recover within 3 months in the initial or else flaccid stage, and they don't have to take the pain of going through the other phases. But unfortunately, there are 30% of population who suffer from Bell's palsy have got major injury or else and second or third degree of nerve injury. For them, it takes more than 6 months to show the signs of recovery, and then they gradually fall in these categories. So the second category of Bell's palsy is the paretic stage, or else you can say facilitation stage of Bell's palsy, where the movement has started happening, but the muscles are weak, there is a lot of facial asymmetry, but at this time there is no synkinesis present. This is a good time for a person to start off with practicing facial exercises. The exercises have to be gradual, slow and steady, because here if you try to do more and more of exercises again, and if you try to start exerting more and more of effort or pressure of doing these exercises, what happens is you will gradually start developing synkinesis. But that doesn't mean that if you don't do this, you won't develop synkinesis. If you have got third degree of nerve injury, there are high chances that synkinetic pattern would be seen. But the synkinesis would be much low, much less if you follow the instructions of doing gentle exercises. In second phase of Bell's palsy, the treatment program basically focuses on, again, first massage to kind of improve the muscle circulation and maintain a good flexibility of the facial muscles. Stretching also keep those muscles away from pain or any kind of stiffness. Apart from that, the exercises have to be small, gentle and focused on the small movements. Mass movements again are not ideal. Yes, you can gradually start practicing mass movements with the help of PNF technique, but again it has to be done in a very controlled environment, which means you need a lot of supervision while doing these exercises. Because the point you start showing the signs of synkinesis, then it's the time first to reduce the level of synkinesis. Because the early you identify synkinesis, it's easy to work on that. More time it takes for the synkinesis to be addressed, more difficult it would be to correct synkinesis. And that takes me to the third stage of Bell's palsy, which is the synkinetic stage. Here the focus is on reducing the synkinesis. A patient is classified in synkinetic stage from the point he or she develops synkinesis or starts showing the signs of synkinesis. Synkinesis can be from mild to moderate to severe, and basis that the treatment is also decided. Mostly the treatment plan comprises of first relaxation, allowing a lot of breathing exercises, massage and a lot of focused relaxation techniques in order to allow the muscles to relax completely. Once the relaxation is achieved, the exercises here are focused on inhibition and facilitation, which means trying to inhibit the wrong synkinetic movement pattern at the same time facilitating or allowing the right movement patterns. The movements have to be very slow, very gradual. The focus is on quality of movement over quantity of movement, and the number of repetitions has to be low. More number of repetitions you do in this phase, the higher chances of synkinesis to increase are there. That's why the frequency can be more, but the numbers have to be really less, which means you just have to do 5 repetitions at max or else 10 repetitions at max for one movement. Since this is a time where you need one-on-one attention and personalized treatment program, make sure to take the help of a professional while undergoing exercises. These exercises are not just random exercises. These exercises has to be very accurate. That's why don't rely on the exercises that are shown on videos, but please take in professional help and then only do exercise in order to achieve maximum or else best results. So friends, my intention with this video was to educate you and inform you what is the possible treatment program when it comes to synkinesis or else Bell's palsy management with the help of physiotherapy or else neuromuscular re-education. I hope you found this video informative. If yes, make sure to like this video, share this video, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.